from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. If you're feeling excessively tired, devoid of energy, maybe demoralized or irritable, you may have burnout. It's actually a syndrome associated with a potentially deadly heart rhythm disturbance. Joining us this morning to explain, Baptist Health Dr. John Allen Cockerell with Sherwood Family Medical Center. Okay, burnout, Dr. Cockerell. This is something that I think we've talked about before. Are you burnt out?
Sure.
Is this something that you're feeling? But this is actually more of a serious medical condition that could be associated with a heart rhythm?
Absolutely.
Okay, so what is it?
This is different than just, hey, I'm stressed out.
Okay.
Or even different than depression. And I know it kind of seems nuanced, but this is a stress-induced mood disorder. So major life stress, usually work, big project, something like that. And yeah, to your point, we'll talk about this later, but this is more than just being stressed out. This is affecting people's heart rhythms, which is really huge and important, right?
Yeah.
So the difference between something like depression and this is depression can be more generalized. This is focused towards a stress. And although depression can have some physical manifestations, and it can, absolutely,
it's real, absolutely. It's real. Yeah.
But this really focuses on mental and physical exhaustion to the point where you're not sleeping, you're not eating, you can have chest pain, heart racing, which we'll talk about, right? Extreme, fatigue and muscle weakness. So this is a very physical manifestation of a psychological issue.
You mentioned a couple of those symptoms, and how those symptoms can be associated with just, stressful days. Is this more of a string of days or weeks of feeling like this, or is it one big episode? What kind of length are we talking about for symptoms like that?
Right. So usually not a one-off. This is a week to 2 week progressive type issue, and it doesn't get any better. Right. It's just continually getting worse.
How common is something like this?
I don't have the prevalence on it, but I do know that it's being diagnosed more and more frequently now. And the reason is I don't think it's become a bigger issue. I think we're just recognizing it. Yeah. And so this is kind of what we're talking about today, because it's been there, but now we're understanding it and diagnosing it more. So I think the cases are increasing, and that's an awareness type thing, I think, for the doctors too out there to be aware of this stuff.
Yeah, something maybe a little newer, and that's why there's more cases.
Sure.
Yeah, or not newer, but newly diagnosed.
Yeah, we're recognizing this as a true medical diagnosis, and that's different than just, again, stressed out or even depressed.
What about treatment options if someone comes in with all these and are diagnosed with that kind of burnout?
Right, so the cheap and easy answer here is rest.
De-stress.
Right.
Yeah. Sounds so much easier than it really is.
I got patients that are, they're single moms. I mean, single dads. Really, they got 4 kids. They're working 3 jobs.
Yeah.
Okay, doc, easy said than done. How do you rest? So it's different for every patient. And so I think it starts again with talking to your doctor, right? Obviously, for me, and by no means am I perfect, but faith is a huge player in my life and central to who I am. So prayer and meditation become really important here. And so that actually has some statistical backing as well to suggest those can be effective measures. Also counseling. So we talk about this a lot. There's not a pill for everything, right? Some of this stuff is best treated with psychotherapy and cognitive behavioral therapy. So getting in with a therapist to be able to help with that is crucial as well.
All right, and if you'd like to talk with the Baptist Health Doctor, you can always call the number on your screen, 1-888-BAPTIST, and go to baptist-health.com for more resources. Thanks, Doc. We'll see you next time.
Sure.